When trying to fix a flat thoracic spine, a lot of the exercises look like this, and this. Instead, we should replace them with this, and this. Before we jump into abnormal, let's first discuss normal. The spine has three sections. We have the lumbar spine with a lordotic or extension curve. We have the thoracic spine with a kyphosis or kyphotic flexion curve. And then we have the cervical spine, which has another lordotic or extension curve. So when it comes to flatness of this thoracic spine, we are literally decreasing that normal flexion or kyphosis that we should have. And this happens from muscles. Muscles start to compress, and it ultimately starts to extend the spine. So a flat thoracic spine is someone that is living in extension. Now, besides the visual flatness that we're talking about, and besides the fact that there might be pain, there's three big things that happen as a result of this flat thoracic spine. Number one, we're going to have poor rib cage and pelvis positioning. Number two, it's going to lead to poor breathing strategies. And number three, it's going to be hard to maintain position and breathing when it comes to exercise. So if you pause for a second and remember the first three exercises that I quickly showed you in this video, think about why are those not the best choice? And why do we want to replace them with the next group that I showed you? Well, if you remember, those exercises were all extension-driven exercises. So why would we want to give someone that lives in extension more extension exercises? Sure, it might feel good, they might get some pops, and they might think that the pops increase their mobility, but we're thinking long-term, right? Or we should be. How do we start to give long-term results? How do we start to restore a kyphosis? We need to increase their movement variability. The only way that we're really going to get that from a long-term perspective is to start to give them movements and start to open things up that are overly compressed. So I want to share three exercises that we can replace the extension-driven exercises with. But in order to really maximize your efforts when you bring your patients or yourself through them, we need to first understand the why. So I want to quickly talk about the reasons behind why those exercises tend to help long term. So the first thing we need to do is get the rib cage and the pelvis in better alignment. Usually with a flat thoracic spine, the body is driven in extension. So we see the rib cage that is flared up and we see a pelvis that is tipped anteriorly. This looks like this. So in order to fix that, we need to find more of a stacked and balanced position where the rib cage is right above the pelvis. So any sort of exercise where we're getting them to go more in that posterior direction and get them to start to breathe, to get the rib cage to come down is going to be required before we go on to any sort of other exercise. Number two, the result of this flared rib cage and extension-driven pelvis is that it makes it really hard to breathe. What tends to happen is because of the position we're in, we just have belly breathing happen. And the problem with that is when we're not expanding our chest, aka our lungs, then muscles just remain tight and compressed, and it starts to feed day in and day out to get more compressed and a flatter thoracic spine. So once we restore a better position of the rib cage and the pelvis, we then need to learn how to exhale, where we can bring the ribs down, maintain the ribs in a downward position, and then inhale and actually start to expand the chest. Remember, the chest is just another way of saying expand the lungs. But think about it. When you start to expand the lungs, you actually expand posteriorly as well. So from a breathing perspective, we can start to automatically increase that kyphosis because the tissue allows us to get more motion just by breathing the right way. And number three comprises of both 1 and 2. We need to challenge the body and make sure we can maintain position from a pelvis and rib cage standpoint and be able to breathe in that while we're exercising. So just getting a better position and just breathing the right way is only half the battle. Can we then be in a stressful position and maintain it. So the first exercise is a simple breathing exercise. However, the power is in the setup. What we're gonna do is throw our feet up on a bench, something where we can achieve a 90-90, 90 degrees knee flexion, 90 degrees hip flexion. You're going to use a bar or a cable attachment or a door, something we can use to outreach and stretch. Then we want our neck really supported. The goal of this is just to learn how to breathe in a stacked position. Remember, we want the rib cage right over the pelvis in a stacked position. So this setup is going to A, achieve that, but B, do it where we're actually getting a little bit more of a flexion or kyphosis throughout the thoracic spine. So what you'll do is you'll go down, you're going to grab the object, go in that 90-90 position, find that posterior pelvic tilt to get a stacked position of the rib cage and pelvis, and then let the setup do the work. All you want to do here is breathe. Inhale through your nose. As you inhale, the chest should expand. As you exhale, you should feel the rib cage go down. If you do it correctly, you'll feel a bigger stretch throughout these lats. And then you just repeat it for 4 or 5 breaths, holding onto this position and learning how to breathe in it. The second exercise is a foam roller plank. The overall goal of this is to A, get a stacked position, B, challenge the body, and C, be able to breathe, right? When we're in these positions and trying to get a little bit more kyphotic through that thoracic spine, we need to be able to breathe and to do it in the right way, because what it does is it continues to keep that thoracic spine more open or expanded. So what you'll do with the foam roller is you're gonna throw it on your mid-thigh. You're gonna go in a plank position, and then you just follow 4 easy steps. You go head down, chest up by pushing through the elbows. You're gonna push the belly button up, and you're gonna tuck the tailbone under and use the cylindrical shape of the foam roller to allow you to really get that rounded position. And rounded isn't even the best word. Think of that stacked position, right? Not here, not here, but a stacked position. Then all we're doing is breathing 4 or 5 breaths. So it's a little bit more challenging than the first exercise, but we're maintaining our good position, maintaining our good breathing patterns. The final exercise is a squat with an anterior load. A med ball like this works perfect, although you could use a dumbbell or something in front of you, but the goal is to maintain a slight reach or a slight protracted position. So what we're doing is we're going up on a slant board. The slant board in a heels elevated position is going to bias a little bit more of that posterior direction. Remember, that's favorable for someone that lives here. So feet are elevated, our heels. We're going to use the med ball and reach around it. That position just gives us a little bit of a posterior weight shift in a protracted position. Not to mention, the rib cage starts to go down, and so we get in a much better position. From here, we're just doing isometrics. So we're going down, really trying to maintain this rounded position, and then breathe. Exhale on the way up. And continue. You go down, maintain that slight protraction. Inhale at the bottom. Exhale.